Hello, it's Dr. Rhonda Johnson. Today is Sunday, May 21st, 2023, and today I'm talking about deaths from drug overdoses that are on the rise in the United States. Now, if you watch me, you know that all this month of May, I've been discussing mental health topics, as May is Mental Health Awareness Month. Well, substance use disorder is a mental health disorder. It can be treated. It involves a person's brain and leads to the inability to control their use of substances that are legal or illegal drugs, alcohol, or medications. Now, my information, the data that I will report, comes from a publication issued last week by the CDC, the Vital Statistics Rapid Release Report number 27, and I'll include the reference. Now, what we know is that drug overdose deaths continue to be a significant health burden in the United States. But did you know that fentanyl, methamphetamine, commonly known as meth, cocaine, heroin, and oxycodone are the drugs most frequently involved in drug overdoses in the United States? I'll be sharing some statistics from this report. So here's one of them. Among drug overdoses between 2016 and 2021, anywhere between 86 to 92% were unintentional, meaning these were accidental overdoses. About 4 to 8% were suicides, and 3 to 5% were of undetermined intent, and less than 1% were homicides. So the big finding is that deaths from fentanyl more than tripled from 2016 to 2021. There was a 55% increase in deaths from fentanyl from 2019 to 20, and a 24% increase from 2020 to 2021. Now, that's the last period that's available in this report. Now, the rate of drug overdose deaths involving methamphetamine more than quadrupled, and the overdose deaths from cocaine more than doubled during this 2016 to 2021 period. But what I was surprised by is that overdose deaths involving heroin and oxycodone decreased during 2016 to 2021. Now, males had higher rates of drug overdose deaths for all drugs and across all racial groups and ages. And in 2021, fentanyl caused more drug overdoses than all other drugs. So there's a lot more data in this report, lots and lots of data, and I'll include the reference link as I mentioned. Now, moving on, I wanted to talk about signs of fentanyl overdose, since it's the most widely used drug that's involved in these overdose deaths. Well, I want to start by saying you can't overdose simply by touching fentanyl. To overdose on fentanyl, you must get the drug into the bloodstream or mucous membrane by smoking it, snorting it, or injecting it. So the symptoms of a fentanyl overdose can include trouble waking up. The person is just unarousable. There can be blue or grayness of the fingernails or the lips, pale or cool skin, or reduced or absent breathing. This is a medical emergency. Please call 911. And if you can, provide Narcan on the scene and try to keep the person awake and breathing. You want to lay the person on their side to prevent choking. Now, how do you get access to Narcan? Well, it can vary state by state. In some states, you can get it through a pharmacy. Others have access to Narcan through local opioid or overdose safety programs, or even clean needle exchange programs. But this may be something you want to know, particular if you have a family member or a loved one who is abusing drugs. So that's my message. It's really not a happy topic for me today, but it is important. It is an important public health issue, and that's why I'm discussing it. Take care, folks. Be safe and be well.